Labor. Outline. Recognizing the start of labor. Symptoms of going into labor. First stage of labor. Second stage of labor. Third stage of labor. Monitoring your baby during labor. Care of the perineum during birth. Suggestions for preparing for labor. Where to get help. Labor. Labor is divided into 3 stages. The first stage is the dilation of the cervix, the second stage is the birth of the baby, and the third stage is the delivery of the placenta. For first-time mothers, labor takes around 12 to 14 hours. Women who have undergone childbirth before can expect about 7 hours of labor. Recognizing the start of labor. Braxton Hicks contractions are sometimes mistaken for labor. These false contractions usually start halfway through the pregnancy and continue all the way through. You may find these contractions visibly harden and lift your pregnant belly. It is not known what triggers the onset of labor, but it is thought to be influenced by the hormone oxytocin, which is responsible for causing uterine contractions. Symptoms of going into labor. Some of the signs and symptoms of going into labor may include period-like cramps, backache, diarrhea. A small blood-stained discharge as your cervix thins and the mucus plug drops out, this is called a show. A gush or trickle of water as the membranes break. Contractions. First stage of labor. The first stage of labor involves the thinning of the cervix and its dilation to around 10 centimeters. The first stage is made up of 3 different phases. The latent phase, generally, this stage is the longest and the least painful part of labor. The cervix thins out and dilates 0 to 3 centimeters. This may occur over weeks, days, or hours and be accompanied by mild contractions. The contractions may be regularly or irregularly spaced, or you might not notice them at all. The active phase, the next phase is marked by strong, painful contractions that tend to occur 3 or 4 minutes apart, and last from 30 to 60 seconds. The cervix dilates from 3 to 7 to 8 centimeters. The transition phase, during transition, the cervix dilates from 8 to 10 centimeters, that is, fully dilated. These contractions can become more intense, painful, and frequent. It may feel as though the contractions are no longer separate, but running into each other. It is not unusual to feel out of control and even a strong urge to go to the toilet as the baby's head moves down the birth canal and pushes against the rectum. Second stage of labor. The second stage of labor is from when your cervix is fully dilated to the time your baby is born. The contractions are regular and spaced apart. May feel the urge to bear down and push. The baby's head crowns, appears at the vaginal entrance. At the time of birth, a doctor or midwife may guide your pushing to enable a gentle, unhurried birth of your baby's head. Once the head has emerged, midwife or doctor will guide your baby's body so the shoulders come out. The rest of the baby will then follow. If prima gravida, the second stage of labor can last up to 1 to 2 hours. A long second stage of labor can result in risks for you and your baby. Third stage of labor. After the birth of your baby, your uterus gently contracts to loosen and push out the placenta, although you may not be able to feel these contractions. This may occur 5 to 30 minutes after the birth of your baby. The muscles of the uterus continue to contract to stop the bleeding. This process is always associated with a moderate blood loss, up to 500 milliliters. In this stage of labor, one of the potential problems is excessive bleeding, postpartum hemorrhage, which can result in anemia and fatigue. This is why the third stage is carefully supervised. There are 2 approaches to managing the third stage. Active management, this is the common practice in Australia. After the birth of your baby, the midwife or doctor gives you, with your consent, an injection of oxytocin, clamps and cuts the umbilical cord, and then carefully pulls on the cord to speed up delivery of the placenta. Active management has been found to reduce excessive blood loss and other serious complications. Expectant management, the placenta is allowed to deliver on its own, aided by gravity or nipple stimulation only. In this approach, the umbilical cord stays connected to the baby until the cord stops pulsating. Monitoring your baby during labor. During labor, your baby's heart rate will be checked regularly. Baby's heart will be listened to every 15 to 30 minutes using a small handheld Doppler ultrasound device or PNARD, fetal stethoscope, and through cardiotocograph, CTG. Care of the perineum during birth. The area between the vagina and anus is called the perineum. Once the baby's head starts to appear, the perineum will tear if it can't stretch enough. These naturally occurring tears can be difficult to stitch and may not heal very well. In around 3 to 4% of cases, the vagina tears right through to the anus. An episiotomy is an intentional cut of the perineum, using a pair of scissors. This clean cut is much easier to control and repair, tends to heal better than a tear, and is less traumatic to the underlying muscle and tissue. An episiotomy may be needed during the last part of the second stage of labor. Episiotomy should be performed only if needed. They should not be routine as they do not reduce the risk of severe perineal injury, urinary stress incontinence or trauma to the baby. Suggestions for preparing for labor. Some women may find the following activities helpful in preparing for labor. Choose your support person, someone you are comfortable with and who will help you rather than distract you during the different stages of labor. Yoga. Relaxation exercises. Hypnotherapy, a state of relaxation. Childbirth education, for you and your support person. Be guided by your doctor or midwife, but general. Suggestions for a woman approaching labor include: once you go into early labor, take the opportunity to rest and relax at home. There is no need to be in hospital until the contractions are regular and painful. If your waters break or if you start bleeding from the vagina, go immediately to hospital. Once you are in your intended place of birth, of fluid, water, juice or ice blocks. Suck on sweets to keep up your energy. Vary your position to keep as comfortable as possible, standing, kneeling, lying down, straddling a chair, or on all fours. Have a bath or hot shower. Ask your support person for a back rub or massage. Try to relax between contractions. If you need or want it, discuss having some pain relief. Resist any urge to push until your cervix is fully dilated. Your midwife will let you know when this has occurred. The pressure of your baby's head helps to widen your cervix, so use gravity and walk around, stand or sit upright. Don't feel embarrassed or inhibited by your appearance or behavior. Your midwife has seen it all before. If you want to grunt, yell, or swear, go ahead. Remember that passing a bowel motion during labor is normal and nothing to be concerned about. Having a support person. Having a support person with you can help enormously during labor. Your support person can encourage you, give emotional support, help to make you comfortable, help with breathing techniques, provide ice to suck if you are thirsty, provide a heat pack for your back or a cool face washer for your forehead, massage your back, celebrate the arrival of your baby with you. Where to get help? Your GP, doctor. Your hospital or birth center. Obstetrician. Midwife.